Hi everyone, my name is Marissa Gale. I'm a social worker with the Canadian Mental Health Association. I've come on today to just kind of chat about some of our services and the changes that we've had in our service model and how we provide services during this COVID-19 pandemic. The Canadian Mental Health Association, it remains open, but we've just had to change some of the ways that we provide services, mainly that our case managers and all of our intake appointments, all of that, that's done over the phone right now, along with a lot of the crisis contacts as well are mainly over the phone through reach out. And then our peer support is offered through the phone, and also they're doing a lot of online programming through their Facebook page, Oxford Self-Help. And they're doing a lot of really great groups and videos and staying mindful during the pandemic and everything like that. So that's another really awesome way that you can connect with CMHA right now.
Well, thanks a lot for joining me today, Marissa. And just maybe if you can talk about how are your clients responding to the changes in these services? I know it's absolutely necessary.
Yeah, absolutely. And it's been a tough adjustment period for a lot of people. You know, everyone I think is experiencing an increase in anxiety, an increase in depressive symptoms. Everything that's kind of going on is really sparking that in a lot of people who maybe never have experienced mental health symptoms before. So then for those people who are experiencing mental health in their daily life, this can really add to it. And it's been difficult because when people need support the most, support styles have changed a lot because of everything that's going on. So there's definitely been a big adjustment period, but I think our agency, along with all of the other community agencies around, have tried to be as creative as possible in, keeping their doors open, allowing people to access supports in different ways.
And talk about what are services available to people who would be watching this that have never in a million years thought that they would need to access mental health services, and now they're finding that they in fact do need to.
Yeah, so through our agency, at least, kind of our first point of contact is often through the crisis team, and they're accessible through Reach Out, which is a 24-hour-a-day, 7-day-a-week crisis phone line. So any time of the day or night when those symptoms of mental health, or you're just having a really hard time processing and understanding everything that's going on, giving them a call and chatting with Reach Out, chatting with the crisis team about, is there next steps that need to happen to support your mental wellness.
And is there anything that you can offer right now for somebody who maybe is feeling confused or depressed? I know we talked about this in our telephone conversation yesterday, and you gave me some ideas that really resonated with me right away.
Yeah, and I think one of the most important things is just recognizing that it's okay to be anxious right now. We're all in uncharted territory. We're all trying to just figure out the ways that we can manage everything that's going on, recognizing that that's okay that this is happening, but what can I do to foster my own mental and physical well-being during this time? And a lot of those coping strategies that people use on a day-to-day basis, they've had to be adapted because a lot of them include being social, getting out of the house, going to see friends and family, and that's just not something that is doable right now. So figuring out for yourself what's going to be most helpful, whether that's learning a new skill or being social through the internet, through the phone, or accessing those formal supports that maybe you haven't needed to in the past.
Right. I know you use the term reframe with me, and I really like that. Just taking a situation and I guess looking at it in a different way or positioning it differently.
Yeah, absolutely. Because even though those anxious thoughts are normal right now, it doesn't mean they can't be challenged, and it doesn't mean that they can't be managed. And figuring out how to challenge those and how to focus on the facts and do that positive reframe like we talked about can be quite beneficial.
All right. Well, thanks a lot for joining us today, Marissa. I'm sure we'll be talking to you again in the future. For Rogers TV, I'm John Payne.